Good afternoon, everyone. This is Ann Cuppinger, and welcome to the Western Region webinar on Family Peer Support Services. We are really looking forward to some good conversation today. Looking forward to hearing from everyone on the call to gain your perspective on what we can do to be most helpful for you. So we're going to start with introductions. Many of you know me. I see a lot of familiar names on the call, and I am now working with the Community Technical Assistance Center, and we're doing all kinds of work with providers, and one really important group of providers that we're focusing on are Family Peer Support Services providers. So without further ado, I guess I'll turn it over to my co-presenter to introduce herself.
Good afternoon, everyone. This is Geraldine Jerry Burton, and as Ann said, I'm also working with the Community Technical Assistance Center. Ann and I are both working together on the family support aspect of the CTAC, and we welcome you, and we're very excited about doing this. And moving forward, we're going to, well, Ann, you're going to do some housekeeping, right?
I am. Yeah.
Go right ahead.
So I want to give you guys some technical information about how to operate the webinar, and then we have a small enough group that I want to have everyone go around and introduce themselves and tell us what program you work for, and that'll just give us a sense of who's on the phone. So the easiest way for you to participate in this phone call, in this webinar, is actually to call in to the webinar. So you may be on your computer and you can hear the conversation if you're only on your computer, but you won't be able to talk to us. So if you are able to call in, we encourage you to do that. There should be a phone number in the invitation email that you received, but also if you look above the elephant, left of the elephant, you'll see a tab called Event Info. And in that tab, you'll see the phone number that you need to call in directly by phone so that you can talk. The other way you can communicate with us is by using the chat function. So over to the right of the elephant, you'll see kind of a speech bubble, and it says chat. If you click that, it will turn it on, and then down below you'll see the chat box. Within the chat box, there's a drop-down menu right next to that Send To label, and if you open that up, you'll see that you can chat to individual people or to all presenters, all attendees, rather. So if you chat to all attendees, then we'll be able to see your comments. If you're not able to participate by phone, we'll try to monitor those comments and add them into the conversation. If you are participating by phone, we ask you to put us on mute when you're not talking, and definitely don't put us on hold, please, because then we end up listening to your hold music from your organization. So I would like to, I'm going to actually, to help facilitate these introductions, I will call on people. I see your names on our list of attendees, and then if we're missing anybody, we'll ask those folks to also introduce themselves. So I guess I'll start with Nikki Hilker.
And she said she can't call in today.
Oh, she can't call in today. All right. Well, Mickey is a parent advisor in the Western region, and she's just a wonderful resource, so I'm sure she'll have lots of great comments by chat. How about Dana Frame?
She's chatting also. She said hi.
Hi, Dana. Okay. How about Maggie? Are you on the phone, Maggie?
Okay.
I think we have a lot of people who are listening by way of their computers.
Yeah.
Sue Mustard, are you calling in?
Hi, yes, I'm on the phone, and I am the Director of Family Involvement for Hillside Family of Agencies.
Terrific. Thank you. How about Nancy Craig?
Hi, I'm Nancy Craig. I'm the statewide director for Families Together in New York State for training and parent advisor liaison.
Terrific. And Jackie Ray?
Hi, I'm here. I am family support supervisor for Monroe Region waiver.
Perfect. Thank you, Jackie. Have I missed anyone?
Hi, Ann. It's Susan Berger.
Hi, Susan. You want to tell everybody what you're...
Yep. I'm the Director of Family Peer Advocate Credentialing and Workforce Development at Families Together in New York State.
Thank you. We also have a couple of folks from CTAC listening in. These are people that you will meet as you participate in various CTAC events. And it's Cara Dean Assail, Lydia Franco, Yvette Kelly, and Brianna Gonsalves, who helped many of you get onto this webinar today. So thank you so much for coming and spending an hour and a half with us. This activity is really just a warm-up exercise to help you understand how you actually can take yourself on and off mute so that you can really actively participate in the webinar, because that'll make it more worthwhile for everybody.
Ann?
Yes.
This is Angie Ritchie, Family Support for the Rehab Center, also joining you.
Oh, terrific. Hi, Angie. It's great to have you on the call. Terrific.
Yes, thank you.
All right.
All right. Supposedly the boss, Kim Baker, is supposed to be on too, but I'm sure she wasn't able to call in.
You know, she was. I saw her name pop up, and then something happened to her, so hopefully she'll rejoin us. Okay.
All right. Just wanted to let you know.
So thank you. So I'm going to turn this over to Jerry Burton, and she will take us from there.
Okay, so again, welcome to everyone, and thanks for the introductions. And so our agenda, as you can see, is we've done the welcome, the introductions, and we're going to have an overview of CTAC and MCTAC, and MCTAC is Managed Care TAC. We will have a discussion about challenges and opportunities for family peer support services. There will be a series of discussion questions. We will talk about next steps, and then we'll have a Q&A. All right. So we have a poll question for you. Actually, we have two, but this is the first of the two. So our first poll question is, which best describes your employer? So if you can just make your selections, and in a few minutes we will have our results. We just want to get an idea of the type of agency you're employed by. And one thing about us here in New York, we are very fortunate to have many types of family peer support services. And at CTAC, we are excited to support all of this work. And we also know that each region has a different makeup of family peer support services with a mix of independent family support programs housed within an agency that provides many services, embedded advocates working in hospitals, residential treatment facilities, CRs, clinics, and waiver programs. So let's see, we should be getting the results. And alrighty, let's see. Another few minutes, we shall see what our results are. All right, here we go. All right, so 3 people said Children's Mental Health Provider Agency. 1 person said other community organization. 2 people said other organizational type, and 5 did not answer. So for those of you, the first group that someone answered other community organization, could you share with us rather what type, the name of your organization or what it is? If you can, if you're on the phone, or either just chat it.
Hi, Jerry. This is Susan. How you doing? As I mentioned, I work for Families Together in New York State, and although they are a family-run statewide organization, they don't provide family support services directly as a provider in any community.
Gotcha.
So that's why I put other.
Okay.
And Jerry, I'm looking at the chat. You know, Mickey is from the Office of Mental Health and Families Together, and Dana Frame is on from CompER program in Rochester.
Right. Okay. And so 2 people did other organizational types, so if they could just let us know about that, that would be great. You can either chat it or if you're on the phone, unmute yourself and let us know. Okay.
Jerry?
Yes.
Hi, this is Susan again. I actually put other, so.
Oh, okay.
Just wanted to clarify. No, all right. The silence was too much for me, so I had to chime in.
Mickey Chat is in. She listed other as it is New York State OMH and Families Together in New York State. Okay. All right. All right. So thank you very much. So let's move on. So CTAC and MCTAC, we have, as you can see, a large group of partners, and we are partnering with a number of organizations to provide you with the best consultation and technical assistance. And the staff of MCTAC and CTAC, as well as all of these partners, believe in the importance of the relevance of peer services, including family peer support services. And our most important partner is you. So I love this picture. I don't think I would ever do this, but I can imagine how these folks feel being in this raft and coming downstream with all this water and everything. But so with all the changes that are coming down the pipe, I mean, I would think that this is how it would feel like. And the good thing about it is what would make this work is a series of things, and they would be leadership, teamwork, you looking downstream, balance, breathing, helpful guides, and hard work. And CTAC and MCTAC look forward to providing you with timely, helpful information to help you navigate your own path to success. All righty. So Managed Care Technical Assistance Center, MCTAC, and it is a training, consultation, and educational resource center that offers resources to all mental health and substance use disorder providers in New York State. And the overall goal is to provide training and intensive support on quality improvement strategies, including business, organizational, and clinical practices to achieve the overall goal of preparing and assisting providers with the transition to Medicaid managed care. So we're also partnering with OASIS and OMH to provide foundational information, as I said, to prepare providers for managed care support and capacity building for providers. And some of the ways we'll be doing that is with tools, group consultation, informational training, assessment measures, information and training on the critical domain areas necessary for managed care readiness. And we will also be doing aggregate feedback to providers and state authorities. So our next slide, Community Technical Assistance Center, CTAC. CTAC, along with the Managed Care Technical Assistance Center, will provide technical assistance for all children's mental health programs, including but not limited to RTFs, CRs, day treatment, HCBS waiver clinics, and family support in preparation for the transition in 2017 to the Children's Medicaid Managed Care Redesign Plan. So you will have access to both CTAC and MCTAC offerings, and these two technical assistance centers work very closely together. This year, CTAC will begin offering a variety of trainings in line with the vision of providing the right services at the right time in the right amount. Offerings will focus on managed care readiness and the provision of family-centered, trauma-informed, and community-based services in all sectors, from residential programs through to peer support programs. Okay. So what can you do to make the most of CTAC and MCTAC support? This is definitely a group project, and in order to be successful, networking within and outside of the community of family peer support service providers, is very important for information and for ideas. If you are a small provider, involve and possibly expand your board. Network with other small providers in your region. Look for the right expertise to complement yours. Your organizations, especially if it does not currently bill Medicaid, will have some important decisions to make about how to develop or partner with others to have the infrastructure needed to bill Medicaid. MCTAC can help you to understand what is needed so you can make the best choices for your agency and the people it serves. If you are a family peer support service within a larger provider agency, be smart about how to manage your program and look for opportunities to be at the table as the larger agency is planning for this transition. If you have been operating largely as a satellite, look for ways you can partner and add value to the other services provided by your agency. And these things are really, really important to be able to do so we can make the transition as smoothly as possible. So here's our second poll question. Our second poll question is, how would you describe your involvement in MCTAC and CTAC offerings so far? We've done several webinars, online tools, resources, in-person events, learning communities, office hours training. So how would you describe your involvement? You just take a few moments and do the poll. Now, these webinars, learning communities, and in-person events are usually open to providers of all types. It could be for adults, children, and a wide range of professionals, all working together toward the same goal of improved outcomes for children and families. When a webinar or workshop is announced, we try to provide you with some guidance as to who the target audience is so you can make a determination about what will be most helpful. Having said that, much of the programming for CTAC and MCTAC cut across audiences, so take a broad view of what might be relevant for you. We encourage you to sign up for the CTAC and MCTAC listservs and think about how the CTAC and MCTAC programming can fit into your organization's professional development program. Okay, oh, here we go. All right. So we have one person, this is their first time, and we want to give an extra special welcome to our first-time participant. One person said they participated in 3 or more. Someone else, 3 people said they had participated in many, and then we had 6 that did not answer. Thank you so much for your participation. All right. And did anybody chat in? Oh, actually, let's see. Okay, no, I didn't see anything. All right, so I'm going to give the ball to Ann. Uh-oh. Ann? Okay, maybe she's having some issues on her end. Ann, are you there?
I'm right here. Thank you so much. Sorry about that.
No problem.
So thanks, Jerry.
You're welcome.
And welcome again, everyone. I think Jerry provided us with some really nice context for some background on what CTAC and MCTAC or MCTAC are doing. And we're going to give you a little bit more information, and then we really want to engage in some discussion with you. The next couple of slides are really designed to kind of help you see that family support is really being viewed as a critical component of the service system as it moves forward through all of these changes. When you look at, these are the overall goals for the KIDS system reform. And when you look at this, you'll see that a lot of what you're trying to do lines up very nicely with the overall goals of the KIDS system reform. So trying to work in a more preventive manner and identify needs early and help families get the services that they need so that, you know, things don't escalate and become more problematic. Working with kids and families in their own homes, in their schools, and in their community to support their healthy development in those environments. You know, being trauma-informed, and I would add family-driven. And also really trying to view the child in the context of his or her family and community as much as possible as we design services. So I think it's good news that the way that you all have been operating is very consistent with the overall vision for reform. More specifically, you know, I think as the state was looking at what are some really important services that are not currently as available as they might be and that need to be included in the state Medicaid plan, one of those 6 new services that was identified as family peer support services. And the implications of this being a state plan service are that it will be broadly available. So it's the kind of service that you don't have to be at an extreme sort of high level of need to access as a Medicaid state plan service. So that should give family support programs a lot of latitude to do outreach and provide the services that they provide to a broad array of families, and also to sort of stick with families as their needs change and they may, you know, move up and down in terms of the level of care that their child needs. So these are really good things. We have lots of questions and lots of transitions to navigate, but some of the fundamentals, I think, are very consistent with the work that you do. We put together this list of questions so that you would see that some of the questions that you have are on our radar. And as I go through these, I want you to be thinking about, are there other questions like this about this transition to Medicaid managed care that, that are really on your mind so that we can make sure that we have them on our radar also. So just to briefly go through these, we know that there are lots of questions about the what will happen with the kind of funding that you get right now. So you have something called 1650 or state aid funding. It comes to you in the form of a grant. There's a lot of flexibility in terms of how you, you know, how you use that money, and it is not yet clear how that, you know, what that will look like going forward as we make this transition. I think that people at the state have absolutely heard your concern that there are families that you serve that are not Medicaid eligible, and even with the expansion of Medicaid, may not be Medicaid eligible in the future. And also that there are activities that you do that may not be Medicaid billable. So we're still, you know, the process is still ongoing for trying to determine whether and how much and in what fashion and for how long that money will be preserved. But it's something that we're looking at, and we'll share that information with you as we learn more. I think you have a lot of questions about rates and rate structures, so that you can figure out, you know, how this is going to work for your organization financially. You're wondering about the flow of business. Those of you who are contract providers for the waiver program know what this is about. You know, some months you may get lots of referrals, other months not so many, and it's difficult to build a budget with that kind of fluctuation. Again, there's not really an answer to this question, but there are some strategies that providers in similar situations employ to try to help with some of this management of the, you know, flow of families and cases, and the implications of that for your staffing patterns. Questions about medical necessity, and what medical necessity really is what kind of need does a child have to have for them to qualify to receive a service, and we're aiming for family care support services to have a low threshold so that families can get this service early on when they first notice that their child and family could use some assistance. But that will still, we're still waiting for further clarification on that. I think there are lots of questions about how family support services will have to adapt in order to work in Medicaid managed care. So you know there's going to be new rules, new structures, some new paperwork, and even some new processes that may dictate how much and how and in what way you provide services to families. I certainly think that the overall goal is to try to allow as much flexibility as possible. We definitely know that you're going to have different funding streams. Medicaid can never be your only funding stream, and that hopefully those different funding streams will allow you flexibility to, provide the full array of services that you want for families and participate in community structures the way you currently do. You want to know if your staff are qualified to provide other services. We're working, we have the Family Peer Advocate credentialing process, and, the outline of those requirements and the training have been, will be included in the proposal to the Center for Medicaid Services, and hopefully, that will be approved. But your staff may be qualified to provide other services, for example, respite, or maybe skill building. And so we're going to be working with you to think about, to understand what those other services are and what the staff requirements are, so you can think about whether you can diversify the different, the way your staff are utilized. Lots of questions around how to interact with managed care organizations. Someone yesterday said, could you please just give me a script? And I think that we can really provide you with some helpful guidelines about working with managed care organizations. The script, probably not that, but I think some understanding about Medicaid managed care in general and about how managed care organizations are looking at service providers and what they want to see happen that will help you engage productively with those MCOs or plans in your region. Lots of questions around, does my agency have the resources to handle all of the infrastructure that's associated with being a Medicaid provider? This really pertains to those of you who are working in smaller organizations. Some may have never billed Medicaid, or some have a very low volume of Medicaid billing. And we're going to be working with you to help you understand what that infrastructure looks like and make some decisions about what the best course of action is for your organization. And finally, we hear this one all the time, this, how can we help you prepare your staff to handle the documentation associated with Medicaid? Everything from how you contribute to a unified service plan to how you, what kind of records you have to keep, how you do write notes, and how you process bills and things like that. So I want to open up the phone lines and invite any other questions that people may have or concerns or ideas that they want to make sure stay on our radar. Anybody? All right, well, apparently we've covered the waterfront quite well with these questions. Now, for those of you who are on the phone, I have promised my colleagues at CPAC that family support providers are not quiet people and that they have lots of ideas and opinions. So for those of you who are on the phone, I really do encourage you to, to add to the conversation as we move forward. All right. Also, with some of these challenges, we have, I think, a lot of opportunities. And I do believe that family peer support services, while you're going to have to navigate some really complex, processes and changes as we really get, fully on board with a new way of doing business, I think that your versatility as a workforce is really a huge asset. And that if you stay open and creative and think about new partnerships, you're going to be in a really good position to expand what you do and to really offer this service, important service to more families. I think the work that you're doing with FANS is really important. There's a lot of focus that's going to be on outcomes as we move into Medicaid managed care, and you're already starting that work, which is wonderful. I think that we can use this as an opportunity to really provide some support to leaders and supervisors to help you help your staff do the best work that they can do and deliver the outcomes that people are going to be expecting. And that's something that we've been talking about for a while, and I hope that this change helps us focus on that a little bit. I think that there are lots of opportunities for you to reach out and work with new partners. People are kind of looking around for who else can I partner with to help us accomplish our objectives, and that will give you some new opportunities. And I also think that while this may be difficult, those, as you engage in these, change processes, you may find that you emerge a more sustainable and strong organization. And I think that the biggest, challenge and opportunity for us is to really try to make sure that we keep the spirit of family support alive. We may have to operate a little bit differently, but hopefully we won't lose what's wonderful about family support and what's really effective at the heart of this peer service. Okay. Terry, do we have anything coming in on the chat from people?
There is one comment. Let me see. Okay. This is from Cheryl Blacklock. She says, I have been sending each of my staff members to the Academy of Peers training so they are certified. And she wants to know, is there something I should focus on, or is this not something that is going to be important later on?
Thanks, Cheryl. The Academy of Peer Services is the training, online training program for the adult peer advocates. So those are adults with lived experience who are working with other adults who are experiencing mental health challenges. And there are, lots of different modules, and I think some of them actually are could be helpful. I haven't gone through them all myself. I've sampled a few of them. And some of them might be helpful, and it's free for family peer advocates to participate in. But that process, that training, and the credentialing that's associated with it are really for the adult peer-to-peer providers, as opposed to what we're talking about here, which is families, parents, and caregivers who have raised a child with significant social, emotional, behavioral challenges, now helping other parents as they navigate the service system. So while I don't think it would be, bad for you to participate in some of those, it won't meet the training requirement for the family peer advocate credential for the family peer support services. I think that some of those modules could easily count as continuing education. So the people who are credentialed as family peer advocates have a continuing education requirement, and I think that any number of those modules could be eligible for that. So this next slide is really, an opportunity for you to think about where you're at and your own reaction to all of this change. There is a lot of change going on all at once. Sometimes things roll out one change at a time, and now we have several really huge changes, and it's difficult to absorb all of this. And many of you are where that first guy in the circle is thinking, what is the impact of this going to have on me and on the families that I serve? CTAC is hoping to, through networking and information and responding to your questions and some new training to help stave off disillusionment so that you can move forward and continue to do the good work that you do. So the next few slides are really intended to provide some prompts for us to have a discussion. So I really encourage you to bravely speak up or chat into the chat box, and Jerry's going to be monitoring the chat box, so those of you who are participating by way of computer, type away. So, we're going to be really looking to try to share some of the strengths of programs across the state. From where I sit, I know a lot about different really great things that are happening here or there, but you all don't necessarily know what each other are doing. And those good ideas range from something very small, like a new strategy for record keeping that's working really well for you, or an approach to how you, communicate with families via text, all the way to, some really big changes that people are involved in, like they're now getting most of their funding from a whole new system than they ever got funding from before. So what I want to do is hear from you about what you think you're doing in your program that you're proud of, that you think is effective, and that might be worth sharing with other people so that we can take notes and think about how to get, that information shared around the network.
Hey, this is Angie from the Rehab Center Family Support.
Hi, Angie.
And hey, our biggest thing right now is we're doing an email/phone support with our families. They're reaching out and wanting to connect with each other and keep us out of the loop, which is what our end result is. So we're utilizing the text messaging and that kind of stuff and pulling on each other that way.
That's great. And so you get that started and then they kind of carry on with each other.
Yes. And they're always looking to add more players and more people to, pull from.
Great. That reminds me of, I think Nancy's telling a story about taking people out for ice cream for a while, family members, and then eventually she didn't need to go get the ice cream anymore. They were going out themselves. So it's really important. And what's nice about that, and I will say in the managed care context, things that we can do to build capacity so that people have the supports that are now natural supports on their own is going to be really important. Any other ideas? Is anyone involved with a new partner? Perhaps, you're getting referrals from a new organization or a new part of the service system that you haven't before, and how is that going?
Let's see. Someone chatted in, from Sue Munster. Our family advocates are change agents and support our other providers and services in being family-driven. We provide group, peer support, education, and advisory opportunities.
Terrific. One of the things I see in Sue's comment there is that they are not only supporting families, but supporting other providers.
Right.
And I think that, that's really an important aspect of the work that you do, not just in terms of what Sue's talking about here, which is trying to help them really adopt family-driven practice, which is so important, but also, and related to that, I guess, help them meet their objectives. So one of the things that you're going to see as we make this transition to Medicaid managed care is that everyone is going to be more focused on outcomes. And some of the things that are difficult for providers to accomplish, family advocates can really be helpful with, and that is also helpful to families. And I'm thinking of things like outreach and engagement, how you really help families connect with services. You help, do away with some of the barriers that keep people from, going to appointments. You help providers interact with families in a way that makes the family feel more connected and more likely to participate in services. You're helpful with bridging between services. And these are going to be very, very valued, contributions, I guess I would say. So as you're looking at the people that you currently work with and partner with, every day be thinking about who else might the work that I do be valuable to. And even if you have to, do some of that work now in a kind of exploratory way, it will be laying the groundwork for some future partnerships that could be very helpful to you, both in terms of you being a part of networks and also financially. Other ideas? Thank you, Sue. All right. Well, I'm going to move on, but I'm going to encourage you to be thinking about the answer to this question. I'm not going to put anybody on the spot, but I happen to know that some of you here are doing some really good work in some different ways. So we'll be reaching out to you to talk further about that, those things, and also to figure out how we can work with you to share that information around the state.
Ann?
Yes.
Maggie says clients are now using email/text as a way to keep in contact with school staff.
Oh, that's a great idea.
That is.
Terrific.
That is.
That's great. You know, I have to laugh because I think that, you know, the families that we're working with are younger, and some of our advocates are younger than me, maybe not than Jerry, but than me. No. I think that, I think embracing, you know, current technology like email and texting, and even, you know, if done carefully, social networking, are going to really become important. In fact, I just got a call from Hawaii recently asking me for ideas that I had on how to use social networking as a part of family care support. And I quickly turned to other people, most of whom are younger than me, to help me answer that question for them. But I think it's important for us to think about, you know, how to safely use those different technologies to network people. Great. Thank you, Maggie. All right. So many of you are supervising family care advocates in your program, and I'm interested to know, you know, many, if not all of them, have gone through or will go through the Parent Empowerment Program training, the PEP training, and then they come back and they work with you, and overall we're hearing really good things about that training and how it helps people get oriented to their role. But what are some of the other skills or competencies that you may be seeing that we could add to that training or deliver separately in the form of a training or webinar that might be helpful to your advocates?
And this is Jackie Ray.
Hi, Jackie.
Hi. There's lots of little areas, I think, especially as we look at PEP, that all of us as advocates can, we would benefit from, like a refresher on engagement, and we try and attend some of those trainings as they pop up here and there. Engagement and barriers. I'm also thinking about professional boundaries because we are peers. It's a conversation we have a lot.
Okay. Yeah, that's come up a couple of times, you know, because it's tricky. Very tricky.
It is. And I think just, you know, even refreshers.
Yeah, yeah. So opportunities to revisit some of that. You know, I've listened to Nancy Craig do some of the FANS trainings around the state, and I thought it was interesting that that training, while it's about FANS, is in some ways serving as a refresher. And people, some really experienced advocates are getting kind of in touch with some of those things that they just haven't, you know, it's hard to take the time to stop and think about it and you know, revisit some of those important things, you know.
And
those are great. Thank you.
I was just going to tie FANS to, you know, burnout and self-help for us as professionals and advocates as well.
Right, the self-care piece. Yeah, that's terrific. Thank you. And, you know, I think about some of the work you're doing, Jackie, around how to tie the plans, the FANS into goal writing and treatment planning, and that might be another area that we can work on.
Sure, I think just like anything else, we're all different human beings and we do things differently in each program. So, you know, one idea might lead to another that might work for somebody else.
Right, right. Thanks, Jackie. Jerry, is there anything coming in on the chat?
Not yet.
Okay.
Oh, wait, I'm sorry. Oh, no. Oh, wait, yes, I'm sorry. Jenny says cross-system training as a supplement because so much is changing, and I agree with the last comment. Family support partners need to embrace the change and understand it is a business.
We're going to get Jenny to do our next webinar on that topic.
Absolutely, especially the
I hope Jenny's laughing in the background.
We know exactly who to plug in when we do our cross systems training.
I see another comment here on working with transition age youth. I just was able to take a look down at the comments.
Oh, wait.
It's hard to see the comments here because they're rolling in, but someone has said we'd like to work, Dana said we'd like to work more with transition age youth. Yeah, and I think, you know, Dana, the challenge there, we were just talking about this morning in a meeting, is that children's providers, especially those who work with older youth, are having to pay attention to the changes in the adult system as well as the changes in the children's system. And there's some crossover access there, but also so that you can help the youth make that transition, if they need to adult services smoothly. So, you know, I think one of the things about CTAC that I want to point out to everyone is that there are lots of resources here, and at first blush, some of them may look like they don't apply to you, but they may. So take a look at the offerings and get yourself signed up. We'll give you the email or the website addresses later on. But if you sign up for those listservs and kind of monitor, and, you know I delete lots of emails like that myself, not from CTAC, of course, but, you know, we get so much email. But, you know, do take the time to look at those offerings and think about which ones may be relevant to you. And if you're not sure, you know, you can shoot us an email and say, you know, is this something that might be relevant to me as a provider of, you know, services to transition age youth.
So, and Sue said info on other overlapping systems, OCFS, OMRDD, et cetera.
Yeah, yeah, okay. Yes, that's definitely something that we can take a look at. And again, we can both partner with people from those systems and also, you know, across the state, we have family peer support programs that are working already with some of those systems in a formal contractual way in their programs. So we can help them, you know, hopefully not just talk about it theoretically, but talk about how it's actually funded and how it's working and what the, you know, what the strengths and challenges are of those different relationships. Great contribution. Thanks, Sue.
Then Dana says, using family support techniques with these transition youth whose parents may not be involved anymore. That's great. And Mickey wrote, yay, well, she didn't write yay, but I'm saying yay. In regards to engagement, CTAC has a number of webinars recorded on engagement for parents and all caregivers. Thank you, Mickey, for that plug. Appreciate it.
Terrific. You know, Nikki, that comment makes me realize that it might be a good idea for us to periodically kind of repost that some of those webinars are recorded and available online, and just, you know, give people another opportunity to listen to them again.
They are. They're still on there, definitely.
Right, but I mean, I think they, you know, they get buried in the website, and sometimes it might be worth, you know, just sending it around again, like here's something you might be interested in. Yeah.
Absolutely.
Thanks. Yep. Okay, well, keep these ideas coming. You know, I think that we are taking a look at the PEP training. Susan and Nancy at Families Together, in partnership with CTAC folks, are taking a look at the PEP training, thinking about, you know, how to freshen that up, keep what's good about it, add some new components, maybe restructure it a little bit so that it's going to work better for people who need to onboard advocates through the credentialing process more quickly as we move into Medicaid managed care, but still offer perhaps over a longer period of time additional training. So we're taking a look at that now. We've got an advisory board. Some people on this call are on that advisory group. And we're really, I think we've got some real opportunities here to, you know, continue to grow that training to help our folks be as effective as they can be. All right. One of the things we hear a lot about is the need for some kind of support for supervisors. We have two kinds of supervisors in family support. We have clinical people supervising family advocates, and then we sometimes have more experienced senior family advocates supporting and supervising younger, newer people. So we know we need to pay attention to this, and I'm wondering if people have any thoughts about you know, observations about what you're experiencing or ideas for how we should approach this or what the need looks like to you. All right. Well, we think about this because I know some of you are supervisors, and so you may want to think about what would be helpful to you, what kind of additional training would help you perform your job as a supervisor. And I think we may want to look at some training that would give people, again, not a singular, you must use this approach to supervision, but kind of a toolkit approach to some strategies for supervising family peer advocates specifically, along with some general advice around supervision. So we're going to be taking a look at this, and if you have ideas or if you see interesting strategies that you think would be worth sharing, stay in touch with us about that. Any comments, Jerry, coming in on the chat on that one?
Sue wrote, tips on using matrix supervision would be helpful.
Okay. And I'm going to be reaching out to family support providers nationally to get some input from them about their strategies for supervision. We have an interesting situation here in New York in that we have lots of different models, ways in which family support is set up. So we need something that's fairly flexible so that it'll fit, in an organization that has, 2 staff members and an organization that's, part of a much larger provider agency with both clinical supervision and peer supervision. All right. We know that many of you are doing work with parents on capacity building. And there's never a good name for this, parenting support always sort of rubs people the wrong way. And I think all of you know that what we're talking about here are the kinds of activities that you might do that some of them are evidence-based approaches, some of them are group models, some individual work, but the kinds of things that you're doing to help families feel like they have the skills that will help them, help their child be successful and help their families stay on track. And I'm wondering what kinds of models or approaches are you currently using, and are there any models or approaches out there that you've heard about that you're intrigued with that we should look into as we think about how to support your work in this regard? Some of the common models that we're hearing people are using, certainly common sense parenting. The state some years ago made a big investment in doing training in common sense parenting. And a lot of people seem to feel that there are at least aspects of that that are really effective. Some folks are using EPIC. Some of you were trained by CPAC a couple of years ago in the use of 4 R's and 2 S's, which Jerry's quite familiar with, which is a group model for supporting families who have kids with disruptive behavior disorders. Strengthening Families is another program that a lot of folks are using. Is there anything that you all are using that you feel is particularly effective, or maybe you have thoughts about the need or the lack of need for further work in this area?
Angie wrote the Kasdan method for parenting the defiant child.
Okay, let's take a look at that one.
Susan, one of our services, uses parents as teachers, which families love for small children, but it is not currently provided by family peer support partners.
Thanks, Susan.
Let's see what else. Anything else? Okay.
Ian, this is Jackie again.
Hi, Jackie.
I think all of those programs have great pieces and parts to them, and I've used 3 or 4 of them with different parents. It just depends on parents.
Yeah.
And the situation.
Right. So you're obviously, if you have an older child, you're going to be looking at a different approach than if you have a toddler or 4-year-old. Yeah.
Sure.
One of the things we heard about yesterday that I thought perhaps some of you, it might resonate with you based on comments you've made, is some models that specifically look at working with parents who have psychiatric disabilities. And, you know, I think that while any parenting program might have, you know, some components that would be relevant there might be some, you know, strategies that we could benefit from learning there.
Any of those programs I've never heard of or tried, and I think there needs to be more of a clinical, maybe partnership in order to work with parents that might need a little bit more assistance.
Yeah.
I'm not sure, but I'd be interested in.
Yeah. It'll be interesting if parents are involved in health homes and their children are involved in the same health home. There may be some more opportunities for that partnership. And I think maybe you're even talking about clinical, you know, support for you all as family advocates, so that you clinical consultation, so that as you're working with the family, you can get some guidance and some input about what might be most helpful.
Yeah, definitely.
Yeah.
Just because some of those approaches that, you know, work with some parents obviously are not going to work for others, and there might be some limitations or barriers that we need to learn how to get around.
Right.
In more of a clinical sense.
Thank you. Someone's posing a question about the parents with psychiatric disabilities. So, yeah, you might have a parent who has, you know, their own mental health challenges, who has a child with or without their own challenges. And obviously, yeah, you could get involved either way, right? So, you know, think about the potential for you also to be providers of services in the adult system. So it's conceivable that there are adults whose children are not identified, who are themselves receiving services, Medicaid services, and there may be opportunities for you to play a role in supporting them as parents, as providers of, you know, a family support service. And I hadn't really thought about that particular one, but there are definitely people who are exploring, you know, sort of out-of-the-box thinking about what roles they might be able to play, what contracts they might be able to get to play some roles in the adult system. And one of them was to work with the family members of adult consumers of services. So, you know, I think it's important for you to keep roles clear, you know, to make sure that you are clear about what you're doing at any given point in time, what your role with that family is. But you have, you know, as I said before, you're a versatile group of people, and I think there's a lot of different possibilities for you. The reason that we're looking at some of these evidence-based parenting approaches is that, you know, with the increased focus on outcomes, if there are ways for you to work with families, either in groups or individually, and really demonstrate that there's been progress in terms of child and family well-being and functioning, that's going to help you make the case for your work with the family. And so that's one of the reasons we're looking at these approaches. Can people tell us a little bit about the contact that you've already had with managed care organizations? Sometimes you hear these that's referred to as the plan. And maybe you haven't had any contact. Maybe you've you know, reached out. Maybe they've reached out to you. You can let us know what that's looked like. This question frequently produces this response, which is complete and total silence. Those of you who are in larger provider agencies, certainly your agency has started to have these conversations, and in your case, it may be worth trying to find out, you know, how family support is being talked about in that context, and to, you know, look for opportunities for you to be able to describe what you do, you know, within those conversations. For those of you who are part of smaller organizations, this is going to become an important thing for you to do, and CPAC will be working with you to help you understand managed care and to think about how to frame your message in a way that will resonate with them. Okay. The other book, before I talk about, or ask you to talk a little bit about outreach, the other thing I would say about working with managed care organizations is that keep in mind that they may be able ultimately to allow you to work in some flexible ways. So, you know, if you can explore, if you know of strategies that are effective, and right now there doesn't seem to be a way to fund that work, you know, don't discount the possibility that that's something that if you can really demonstrate the effectiveness of it, that managed care may be open to. And I'm thinking about the previous conversation around working with parents whose children don't have identified needs. Right now, you can't do that because your work is all tied to the identified child, and it will be in the children's system going forward. But you may have an identified adult in the adult system that same managed care organization is responsible for, and so that's the kind of flexible thinking that we're talking about here. You know, so just keep those possibilities open in your mind. All right. So, in this, yeah.
We have a chat from Mickey. She wrote, currently we cannot provide services to a parent of a typical child. It is worth exploring, but currently we cannot do that with OMH dollars. I know some of you have. And she also wrote, meaning some of you have approached managed care organizations.
So this is Nikki writing from her vantage point as the regional parent advisor, you know, sharing with us that some of the folks on the call have done some communication with plans, and that's really helpful. And maybe, you know, it's not something that, you know, you want to talk about today, but I do think that as you meet as a leadership group regionally, because I know the folks in the Western region do that, share with each other about those conversations that you're having so that you can, you know, learn a little bit more about the plans in your region.
Absolutely. Okay.
All right. So the only thing I think I want to sort of go quickly past this slide because I think we've covered it in a couple of different ways, but does anybody, if anybody has a new strategy that they're finding works really well in terms of connecting with families that haven't been able to, that where you can reach families that you haven't been able to reach before, to connect them with family support, you know, I think we'd love to hear about that because that's going to become increasingly important.
It's Angie Ritchie again. We have reached out to, I've attended Special Olympics with the kids and the families that attend there that have a dual diagnosis. And then we've started a lot of family support groups in libraries, in schools that are bringing in a whole different type of parents that still have issues but don't have services yet.
That's terrific. So, like, the school library is a nice neutral location, right? Like, it's, and if people are used to going to PTA meetings and things like that. What a terrific idea. Yeah. And are you receiving, Angie, OPWDD funding for some of your work with dually diagnosed kids?
Not yet.
Not yet, but it sounds like you're trying to open that door.
Yes, Kim is really looking into if we can do something like that, but we are definitely doing the dual diagnosis stuff.
That's great, and such an underserved population too. You know,
yes,
those families really get kind of bounced back and forth between those two systems, and you could really be helpful there. You know, I can connect you to some other folks, even in your region, who are doing some work with OPWDD, so you can learn a little bit about what they're funded to do.
That'd be phenomenal.
absolutely an opportunity for family support programs. Yeah.
Wonderful. Thank you.
Terrific. Great. Anybody else? Is anybody working in partnership with a pediatrician's practice or in a general medical setting of some sort at all?
Ann?
Yes.
Jenny wrote, we are meeting families in CPEP in Erie County. Mickey wrote, one of our directors does, what is it? I guess Facebook Coffee Hour Blast, sending out a day, location, and folks meet up for coffee and conversation. That's great.
Terrific. That's great. And again, a use of social networking. And Jenny's reference to the CPEP, I think probably most of you in the Western region know what CPEP is. It's not a term that's used all over the state, but it's the psychiatric emergency program. And there are definitely going to be some new opportunities for you to partner with crisis services, with hospitals that are particularly focused on psychiatric treatment, but also with, general emergency room programs that do see a lot of kids and families who are dealing with behavioral health issues. So it's definitely an area for you to look at for expanding the work that you do and the support of the work that you do. And, some of you have heard the term DSRIP. And the DSRIP program, while it is primarily focused on adults, it would be good for you to make contact with the different DSRIP projects in your region, and we can get you connected to a website that lists some of those projects, because there may be some opportunities for kids providers to help hospitals meet their target to reduce admissions and recidivism to hospitals. I think family support could really be very helpful in that regard. If the district has a kids initiative, you might be able to get connected to that. Okay. Thanks, everybody.
Before you move forward, if Jenny could kind of chat in and let us know, she said that they are meeting with families, but what are they actually doing with the families? Are they providing support, advocacy? I'm curious to know what it is that they are doing with them, and I'm sure other people may want to know as well, if that's possible.
Yeah, no, that's great.
You can go ahead, Ann.
Okay. Jenny, you can chat in later. We'll fill in the blanks as we move along here.
Definitely.
Okay.
Thank you.
Okay. So from where you all sit as leaders of family support programs, I'm interested to know, kind of what your top 3 list is of things that we can do in terms of providing you with information or technical assistance in the next 6 to 12 months. Now, we've all been given a little bit more time until the launch of, children's Medicaid managed care in January, or in your case, July, actually, of 2017. But there are lots of things we can do to help with readiness. So let us know what's on your top 3 list so that we can target our efforts. One of the things we heard loud and clear yesterday is we don't really understand what's going to happen with health homes. And so I think the answer to that question is still emerging, but I think we can be helpful in sharing some information with you about what that transition to children's health homes in October is going to look like. Okay. All right. Well, you know where we live, and we're also going to be sharing our email addresses with everyone. Oh, it looks like we've got something coming in, Jerry.
Yes. Angie says, technical assistance, we're trying to put together a tracking system about the families we serve.
All right, Angie, if you're on the phone, can you tell us a little bit more about what kinds of things you're thinking about tracking?
Sorry about that. My phone keeps going in and out, so I never know if I'm getting through or not.
Mm-hmm.
We don't have any type of a tracking system for about visiting our families about statistics and things like that. That's what a technical assistance is. When MHA closed, the program they had it was a homegrown one, and it didn't make it the transition to the new company. So we're hand over hand tracking all this stuff at this time.
Okay. So you're looking for some guidance about how to do that. Yeah. I mean, the one thing I would say to everybody is that whatever you can do without having the tail wag the dog in terms of data collection is a good idea. There's not a wrong approach. I mean, I think that, if you can, we can definitely provide some ideas about how to look at data collection in general and the use of data. And that is something that, will be forthcoming. And obviously that may be a general conversation that then we have to help figure out what does that mean for family support. But I think there's a myth out there that there's sort of a perfect way to go about this. And I would encourage everyone to do whatever you can right now to consistently collect, at least some information about the families that you're serving and their needs, and then also tracking the nature and amount and cost of the work that you're doing with them. Because at some point, somebody's going to want to know, well, what's a typical course of involvement look like with the families that you serve, if there is such a thing? Or do you see different levels of involvement that you feel you need to have with families, and what does that look like? And, if you can track how many hours of what kind of service you provide, and you know what your total costs are, it's going to get you closer to being able to have an intelligent rate conversation, which, is something that you'll need to eventually do. I mean, obviously, if there's anything you can do in terms of outcomes, that's also really great. It's harder to do, but there are some, some simple things that you might be able to do, and we can talk more about those. So thanks, Angie. Okay.
Thank you.
Anything else?
So, Jenny, thank you so much for responding to my question and about what they actually do at CPEP. And she wrote, we asked them to sign a consent for follow-up. Some get referred to our child and family support program, so we provide family support. Some we connect to SPOA, linkage to clinics, whatever they need. The hospital pays us to be present in CPEP and behavioral health floors, 43 hours per week. If the family agrees, we follow up. ECMC and Ryland pays us fee for service to do follow-up. Sounds good. All right, cool.
Really good. Really good example and something that other people may, want to look into where you are. So that's terrific. Thank you all for your thoughts on this. Yeah.
Absolutely.
All right. And I see networking already happening as people are promising to email each other about various things. So really, we are each other's best resource. I mean, we're going to be looking at other states and other systems and other kinds of similar providers to bring some good ideas into the conversation, but the more networking you can do, the better. And I'm so happy that you have, regular meetings in your region. So I'm going to cruise through a couple of these slides. We've talked through about most of this, but these are some of the things that MCTAC and CTAC will be able to help you with. And I've gotten some great ideas from all of you today. And, Jerry and I are putting together kind of a summary of some of what we've heard on these calls. Happy to share that with you, and that will really help guide our efforts. So thank you. One of the things that, there will be webinars, there will be some in-person events, and also some learning communities which are sort of more involved, learning opportunities for you and a smaller group of your peers to work on a particular issue that you have in common that you want some guidance on. So really take a look at those websites, and we're going to tell you about some of the things that are coming up in the next short period of time.
Okay, so upcoming, we have a Children's Summit that's coming up, and it is June 29th, and it's a 2-day. The same thing will be happening both days. The one on June 29th is a Monday, and it's going to be in New York City. And then there's another one June 30th in Albany, and Ann will expound on that in a few seconds. Then we have MCTAC Managed Care Readiness, which would entail readiness assessments, HCBS Provider Infrastructure Training, Revenue Cycle Management and Utilization Management Trainings. Then we have Contracting Series. MCTAC and CTAC work with plans, that's the MCOs. We'll have a series of summer webinars with focus on family peer support services. Then we will also have a summer webinar series with a residential focus. There will be fall regional leadership events, learning collaborative opportunities, and family peer advocate advisory group that we will be doing as well. And we encourage you to take part in those things. One of my favorite slides in this presentation, keep calm and be open-minded. There's a lot that's coming down the pipe, a lot of changes, but we encourage you to stay positive and also just know that CTAC is here to assist and support you in this transitioning process. It's going to be a very trying time, however, we can do this together. Please don't hesitate to contact us as we move forward in this journey. Ann?
Right, so probably, hopefully, many of you have heard about the summit that Jerry just talked about, and for those of you in upstate, that's on Tuesday, June 30th. Agencies have been invited to send 4 members of the leadership team to the summit, so some of you may be involved in that, and if you have any questions about that, you can give us a call. It's really shaping up to be a wonderful day of workshops and also some plenary sessions that are going to bring together folks from New York State, but also some people from other states that have been through some of these changes to help us see some of the possibilities. So I think it's going to be a great day, and if you have questions about, if you're, for example, part of a small organization and you didn't hear about this or receive an invite, I'm going to show you how you can get involved. If you're part of a larger organization and you haven't heard about it, you may want to contact folks from your agency to see if you could be one of the participants. So there is some work that has to be done before you actually receive a link to register for the summit, and that involves the completion of a managed care readiness assessment tool and its children's addendum. And this does involve a little bit of work. There's a webinar on the CTAC or on the MCTAC website that will kind of walk you through the components of the readiness assessment, although you may just be able to do it on your own without that webinar. I just wouldn't want anyone to be put off when they see it, because there will be a lot of opportunities for you to say that you really need a lot of help with one aspect of managed care readiness or another. And I just want you to know that you will not be alone. So don't let that stop you from completing the assessment. We're trying to actually learn what kind of help people need. So it's okay if it looks like you need a lot of help. But once you complete that readiness assessment and submit it, and there's a whole process for that, then you'll receive a link to allow you to register for the summit. And we really hope that as many of you will participate as possible. And if you are a family advocate that's a part of a larger organization, definitely find out if people are planning to attend and encourage them to put together a team to do that. Any questions or other thoughts before we wrap up the webinar? All right. So 2 other things we'll share with you. One is these are the addresses for the 2 websites. There are 2 separate listservs. Sign up for both of those. And I actually think on one of the websites you can kind of sign up for them both at the same time, but they are 2 separate listservs. And we really do encourage you to take a look around the websites and see what's already there. There's a lot of recorded information there, as Nikki was pointing out. Might be useful to you in staff development. And tomorrow we have one more listening session with New York City. I'm excited about that. And this is our contact information. So I want to thank everyone for participating today, and I hope that this is just the beginning of you being in touch with us to ask us questions and share with us, good ideas about the work that you're doing, the successes that you're having, and we're really looking forward to a good ongoing relationship with all of you. Thank you very much.
Thank you. Have a great day, everybody.